Good afternoon. Thanks for joining us. I'm Dustin Lukey in for Dave Soley this evening. We begin with SAND. Now that stands for Supporting and Nurturing Development, and it's a program Gundersen Health System put into place during the peak of the pandemic nursing shortage. It works by pairing younger nurses with more experienced coworkers who serve as a mentor. And News 19's Colton Emsweiler's caught up with one of these teams and shares how this program helps.
For the last 6 months, pandemic grad Molly Tranel has been paired up with 5-year veteran Jill Wada as part of Gundersen's SAND mentoring program. During that time, the latter has taught her young teammate the ropes of being a labor and delivery nurse, and there's no shortage of lessons to learn as school doesn't always prepare you for what's ahead.
Being in labor and delivery, it's a lot of emotional support. We touch on that and learn about it in nursing school, but there's nothing like actually being a support person for someone who may be going through birth alone, maybe going through birth after something traumatic. School doesn't really prepare you for that, and so being able to reflect with someone after that experience is really helpful.
And spending so much time together, a bond forms between SAND mentors and mentees, giving tips on how to handle the stresses of the job outside the hospital walls.
I think while you're working on the unit, things are really busy and fast-paced, and you don't necessarily have time to reflect upon the work that you do. Meeting outside of work allows you to think about the job that you do. Even though the job is stressful and challenging, it gives you time to think about why you do the job, why you enjoy the job, and how rewarding the job is.
A reward that not only reinvigorates their passion for the job, but promotes bonds with their newfound coworkers as well. Reporting from La Crosse, I'm Colton Emsweiler, WXOW News 19.
And the Gundersen SAND program extends to almost every department that has nurses on Gundersen staff. Of course, labor and delivery involves helping those youngest patients who you saw there, something both nurses enjoy. And the little girl we met in this story was born just 6 hours before our team got there this morning.